Everybody talks about AI compliance like it's just a stack of paper. Sign a BAA and you're safe, right? Well, not exactly. If you're actually building or buying AI for healthcare, you need more than just a contract. You need architecture. Today, we're talking about the cutting edge technology that keeps data private while the machines learn. It's called privacy preserving technology, and it's going to change how you look at security. Stay tuned. We've covered the rules of AI a lot on this show, but we haven't spent enough time on the tools. How do you actually feed data into AI without, say, exposing patient names? Joining me to solve that puzzle is Timothy Nobles. Timothy's an expert at the intersection of AI, healthcare, and data privacy, and the Chief Product Officer at Integral. So, Timothy, welcome to the show.
Hey, Adam. Thanks for having me. I'm super excited to be here today.
It's great to have you. To kick us off a little bit, tell us about your background and how did you end up focusing on this specific niche of privacy and AI?
Yeah, thanks, man. So I'm based in Nashville, Tennessee. So the way I kind of always tell the story is I had to start adult life as a professional rock and roller, as you do in Nashville.
Naturally, yeah.
And then it was really just an issue of when, not if, I would end up working in healthcare. After a long time on the road, I decided to get a big kid job and started focusing on data. Kind of started my path in data in the marketing discipline, and then kind of quickly matured into product. And along the way, I had the distinct privilege of developing, predictive analytics products that served a number of domains, but in particular, top healthcare, top insurers, and top self-insured companies. And, with that, the need to protect, patient privacy and individual privacy, was paramount in all of that. So, but the process was always really difficult and super confusing. So, it's kind of led to a point of, with Integral, the opportunity to participate in helping others really understand how to navigate working with privacy regulated data in a compliant way.
Yeah, and I'm sure you bring a lot of rock and roll to the product still, right?
I have my moments.
Awesome. Okay, well let's get into some definitions here because it's an interesting topic. So we hear the term PET, privacy preserving technologies, thrown around in high level security circles, CISOs, compliance officers, CTOs. For a clinical manager or a startup founder listening today, who are the majority of our audience, who isn't necessarily, a coder or someone that knows IT and infrastructure too much, can you define what PET, privacy preserving technologies, actually means in plain English and how it's different from, let's say, just encryption in transit, encryption at rest?
Yeah, no, it's a good bit. So, PETs or privacy enhancing technologies really are fundamentally, tools or techniques that enable you to work with the data in such a way that you are preserving the privacy. And so, that helps you with the regulatory framework or just mitigating the risk of, the data being re-identified. There's a whole lot of shapes, forms, and fashions of how, PETs take, kind of come to life, if you will. One of the things that I encourage people all the time is first start with the fundamentals, make sure that you're thinking through, even the simple things of, how do you destroy your physical documentation, and it's just simple stuff like that is actually an example of managing privacy in a fundamental way, because you're not, shred it, for instance, so you're trying to make sure that that's not, leaking, but then you get increasingly more sophisticated based on what you're trying to accomplish. And so tokenization is a really good example here, where through deterministic inputs, meaning if the same inputs are given, the same type of result happens, the ability to work in tokens and hashes instead of, direct identities starts to become really useful. And then the techniques just get increasingly complex from there.
Yeah, I want to drill down a little bit into the toolkit, if I may. So there are two buzzwords that keep popping up in headlines I've talked about them recently on the podcast a little bit. We've discussed them with other people. Synthetic data, and then differential privacy. Can you break those two terms down for us and maybe give us some real world examples of how a healthcare company might use one of these types of strategies to train an AI without exposing real patient charts?
Yeah, absolutely. So one thing I would say that's really important, and I mean, anybody that'll ever listen to me on this, I probably sound like a broken record, but it's never just one thing, right? So when it comes to privacy, and it's really that idea of defense in depth, that our friends in technology, and infrastructure support have championed for a long time, right? And the same is true in privacy. Just remembering that there's no one thing that's going to remedy this, but it is a series of things in concert and in tandem with each other that are going to give you the best protections and the best kind of posture and confidence to do the work that you want. To your specific question, synthetic data is really fascinating, right? Because there's a lot of pros and there's also some cons with it, right? Where you're trying to decide, especially in AI, where you're trying to decide if a model is going to do what you think it is, working with synthetic data, which is representative of a real data set, can be really powerful because the types of controls you have to have around it are, low to no. And you can just let just about any engineer pick it up, do some work with it, and get a lot of progress in terms of, confirming that what you're trying to accomplish is there. Where synthetic data can produce some challenges is, where you start fundamentally using what was a synthetic run to then go make new data, and you kind of start having a little bit of fidelity loss because some of the finer points of the original data start becoming increasingly obscured, right? That doesn't mean that you shouldn't use synthetic data. It just means that you need to be mindful of what happens, downstream, and does that fit or not? The biggest difficulty I've seen working with synthetic data is where you're getting into rare clinical use cases. Oncology and neurology are two really good examples because the uniqueness of the diagnosis fractures so quickly, based on the individual. And so that's where synthetic data tends to smooth those corners and take out some of that, high nuance, if you will, of the real data. And so, again, it's kind of based on what you're trying to do. Differential privacy, it's really just about introducing noise to the data, right? So it's a kind of scrambling the signal a little bit without destroying the fidelity. Now, differential privacy, when effective, is pretty interesting because you've actually applied other techniques, right? So there's very often tokenization has happened. Very often there are some remediation strategies that have been deployed. So things like taking from a zip9 to describe a geography to say a zip3, or perhaps recoding it to an MSA or a DMA type geographic boundary, right? So this is that whole thing of it's not just one thing. But then even though you've made some of those remediations, then you can actually introduce the idea of, kind of in spirit, adding a little bit of noise to the data, such that you're further reducing what is the risk of re-identification within a data set.
That really, helps kind of define the terms a lot more there. And I think you covered a little bit of this, but we've had recently a conversation with some privacy advocates like Dr. Edward Sharpless, that de-identification is becoming a bit of a myth. The argument that they put forward is that even if you strip the names, the mosaic effect allows data brokers to reassemble that patient's identity by cross-referencing their data with things like credit card swipes or location data. So I guess I'm playing devil's advocate a little bit here, but first of all, if we're in agreement that there's the risk of re-identification and it's never truly zero, that risk, why are we still trying to sanitize real records? Why don't we just move to the synthetic data approach? I think you touched on that a little bit, but I want to just kind of put it out there as front and center a little bit.
Yeah, that's a fun set of questions. So, with that, as to the mosaic effects, the point of de-identification is right, at least philosophically, in my opinion. Is that just strictly the act of de-identifying by itself really just isn't adequate. Taking someone's name out, there's still enough clues, usually within a data set, that the potential for reconstruction is very high, right? And so when you kind of think about privacy rule and sort of like the methods and techniques that are described within HIPAA's privacy rule, you can start to look at what is a direct identifier and what is a quasi-identifier, a QUID or a QI, depending on which acronym you prefer. And it's those QUIDs that can get you in a lot of trouble, right? So it's like, yeah, you did take the names out. Yeah, you might have taken a direct address out. But meanwhile, there's still all these clues about geography. There's these clues about doctors you saw, or even potentially the ability to say, hey, you're in a I don't know, a Porsche fan club or something of that nature, in which case now all of a sudden the distinctiveness about your record, even though your name is not there, has suddenly gone way up within this aggregate, within the data, right? So then you go look at the depth of information, especially in consumer files and credit card swipes, as you referenced earlier. That's real, like that ability. But that's also where, the mosaic effect can be managed when you're thinking about the idea of kind of flipping the mindset to say, hey, well, really what this is about is mitigating the risk of re-identification, not trying to purely de-ID. Because if you actually were to go fully de-identify a data set, there really wouldn't be any value left in it because of how much you would have to take out. And it would be very destructive to the commercial and strategic value of what you're trying to accomplish, especially in health. And so if you take the framing of, hey, I need to actually join this data, but strategically you've taken the time to understand why you want to bring this data together and what you're trying to accomplish, you're then able to look at mitigating the risk of re-identification. And how do you keep that very small, kind of in the spirit of quoting privacy rule there. And as a result, you can then say, well, how do I contour those data elements to where I'm not risking, or at least minimizing the risk of exposing an individual uniquely within a data set. But meanwhile, I've been able to retain some level of value in it, right? As far as the point of like rushing to synthetic, kind of the juxtaposition slash catch-22 for me has always been, well, you got to have the real data to make good synth data. And so like, where does that happen? Who's got those keys? And how is that ultimately managed? And, kind of the quality of that being driven and maintained relative to what's trying to be accomplished, right? Now, again, I think there are a lot of use cases where synthetic is a very valuable use. Like we even will sometimes execute synthetic data creation based on inputs given to us from a customer where the data movement has to stay extremely low, for instance, right? Just their risk appetite doesn't want to do that. And so in order for us to help them understand what the risk look like, as a means to an end, if you will, like we'll generate synthetic data just to help give them a look at what the intention of joining these couple data sets will look like after compliance has been achieved, right? And so it's like a little bit of a look around the corner, but that still doesn't replace the necessity for the actual data to be evaluated at some point.
Yeah, that clarifies things significantly. Thanks for diving into that, because I think generally the synthetic data for a lot of use cases is appropriate, but I see where you're coming from when it comes to more niche fields of healthcare, and then also what do you use to generate the synthetic data in the first place? It makes sense. It almost feels like there should be some sort of centralized, trusted authority for those kind of operations. As far as I'm aware, that doesn't exist. But yeah, no, it's interesting. Are you aware of anything like that existing where there's a centralized?
No, I'm not. I think you might have a grand idea.
Yeah.
Yeah, but I mean, like,
No.
just to kind of give you a little follow on. I mean, just taking like dermatology images, right? It's like that has to be a snapshot of someone, originally for, even the most sophisticated AI to go produce it. It has to learn from something, right? It's like, the computers don't know it's an orange until you teach it that it's an orange,
Yeah.
And so there's things like that. I would say the ability to produce, synthetic, A37, medical claims, those kind of things, just because one, the structure is so much better understood. It's like well documented. It's very mature. You don't see a lot of variability in it. I think there's a lot of potential in that to help with things like pre-training. But by the time you're getting into reinforcement and fine tuning on AI models, like you really do have to be getting highly precise and very specific with the data in order for the models to be effective in the way you need them.
Yeah, I think that makes a lot of sense. So I think I do have a question for you about specific to our listeners in terms of small to mid-size healthcare practitioners and medical groups. But first, I want to give you the opportunity to maybe talk a little bit about what you're doing at Integral and what like how the PET plays into what Integral's doing.
Yeah, no, I appreciate that. So we focus on helping organizations work with privacy regulated data, period. And so with that, we have a lot of specialization in HIPAA, in particular, expert determination. In the spirit of it's never just one thing, we have a core set of algorithms and capabilities that allow us to understand what the data is, and then be able to look at that in conjunction with what are your physical controls and your contractual controls. A very important point too. Some people might be willing to argue with me on this point, but I do think the contractual controls are also privacy enhancing tools, at least, because explicitly saying, hey, don't re-identify, hey, you have to have a segregation of concerns, those types of things are also really important.
No, 100%. On the outset of this introduction, I mean, I said that compliance isn't just a stack of paper, but the key term there isn't just a stack of paper. Like the paper and the contracts do definitely matter. Yeah. Sorry.
No, beautiful. But with that, we then are able to statistically identify and quantify where the risk is within a data set, and we're able to articulate that, and we do it in a very transparent and collaborative way with our customers. And so, kind of the thing is, like, we'll never pretend to know your business as well as you do. So our job is to help you have evidence, right? And with evidence, you can make really sound decisions. The reality is that in order to be compliant, there's always some kind of modification. I'll go so far as to say a compromise. Compromise isn't necessarily negative. It just means that, hey, something's got to give a little bit in order for the risk of re-identification to be managed effectively. And then with that, the set of instructions and the documentation, i.e. the determination report itself, to help downstream. And then we also have very significant pipeline capabilities. Like, we can actually pick up fully identified data, help do all the transformations, and get that down to ready for work production data lakes based on what the expert determination requirements are.
Yeah, so moving on then to focusing on our audience, which are a lot of smaller technology providers, whether it's applications or mid-sized medical groups that have applications that they're looking to make sure that they stay up to date with security for and HIPAA. So they're not necessarily all the massive enterprises like United Healthcare or Google or something like that. Is this technology something that they need to be looking at right now, or is it still kind of just in its early stages? And
yeah, that's a really good question. I would encourage anybody that works with privacy regulated data to be thinking about the idea of privacy by design and privacy as infrastructure. Because the more you weave it into your core processes, the better off you're going to be. And I mean, even as you've mentioned on past episodes of this show, the idea of practicing, being ready, it's important. And so how do you kind of you're always doing something that is privacy oriented is really important. The level of sophistication you need to bring to the table, of course, is highly dependent upon what it is you're trying to do as a business. But just simple things like, hey, role-based controls are wicked powerful in all of this, right? Sometimes smaller shops will give everybody administrative privileges and things like that. And it's like just don't I mean, really, to be quite candid, I mean, even as an executive at Integral, there's a lot of databases I don't have access to because I don't want it. I don't want to run the risk, not that I don't like playing with the data, but it's just like no reason for me to see it. So no. But it's like it's just that type of thinking ends up going a long way. And then also, being really mindful of what state does the data need to be in, right? So, to your point earlier about encryption, at rest, okay, that's cool, that's important. But at the same time, does it have to actually be fully identified? Do you have to retain it that way? Are there ways that you can break that up, and you're just getting smarter with your architectural decisions on how you're storing and managing and recalling data? And so, and then like we were talking about earlier as well, just a little bit of like what are just your basic physical controls? Like are you putting things under lock and key? Are you trying to make sure that you're not leaving handwritten notes face up from a clinical encounter? Just like simple things like that. Like they really do compound and aggregate in very meaningful ways.
We're used to HIPAA compliance being mostly about policy binders and risk assessments. Do you see a future where this kind of privacy technology becomes a HIPAA requirement, like a regulatory requirement? And are we, if I could have a follow-up there, are we moving towards a world where you must use specific tools to be compliant?
Yeah, that's a fun question to consider. To be quite candid, I don't know if it's going to ever come down to like, oh, you have to use these tools or else you're not, compliant. That said, I do think if you kind of look across the globe, at all the international, privacy regulations, there's a lot of shared sentiment between them that looks a whole lot like HIPAA, right? And the thing in that is going to be really more how are you utilizing technologies and processes that are helping you be more aligned to those principles, right? It's kind of funny, anybody that's spent time in HIPAA, this is always just a giggles statement to me, is that like HIPAA is actually surprisingly well documented by contrast to other privacy regulations. At the same time, really what it is, do you understand the spirit of it? And if the actions and the tools and the processes that you are trying to identify and implement are helping you stay more aligned to that more consistently, you're going in the right direction. Doesn't mean you're foolproof, but it means you're going in the right direction. I could see, a set of scenarios where HIPAA's guidance starts to evolve to where the application of very specific techniques for specific disclosures or recipients or output environments. So we'll just use AI, for example. Like you want to be really mindful of the AI's memorization and reconstruction and linkage amplification type concerns, but like there's also techniques that can be deployed. So HIPAA might guide and say, well, hey, it really wants differential privacy and it wants like more specific risk values and lower risk values to be present statistically before AI use cases can be considered as compliant to the expert determination standard. And so I could definitely see some things like that potentially coming about. But the dictation of saying, well, if like if you're not using Azure, then you're wrong. Nothing against Azure, big fan. But like I don't necessarily imagine.
I agree. They most likely wouldn't be naming any brands of tools or anything like that. But potentially processes or types of technology might start to make its way in.
Yeah, and I could definitely see a bit of more expectations around cryptography and advancements in that way as well, just in terms of how, I would say, like, take clean rooms, for example. I think there's a lot
What
of
was that, sorry?
clean rooms.
Clean rooms.
Yeah, so there are these ways that the data owner can actually load data and define what's allowable, and it's only aggregate values can come out, kind of thing. But meanwhile, you can go in and query. CMS did some really cool stuff in the VRDC, kind of in the same vein of this a while back. And but the point is, like, we're going to see, like, more and more and more zero trust type architectural considerations and data sharing. But I mean, again, this is all, in service of trying to protect the data and protect the, identities of the individual. And I mean, no secret, the less you're moving data around, the less you're exposing the risk, from would-be attackers.
Yeah, definitely. Well, this has been fascinating, Timothy. Before we conclude, and it is good to know that there's tools out there that can help organizations actually apply that culture of security at a technical level, and it not just be like a compliance, like, rules level coverage. So before we go, could you maybe let the listeners know if they want to learn more about Integral, where they should go, and if there's anything else that you want to let them know about, feel free.
Yeah, thanks for that. So use integral.com is the best way to find out more about Integral and what we do and how we support organizations, big and small, when working with privacy regulated data. If you have any questions or follow-ups for me, you can just find me on LinkedIn at Timothy Nobles. Just search that, and right there, I believe it's just .com/Timothy Nobles. It's been a minute though since I've looked.
Awesome. Well, thank you so much, Timothy, for joining us, and we'll be sure to link your profile and the useintegral.com website in the show notes. Thank you for joining us.
Thanks, Adam. Appreciate it.
And for our listeners, remember, compliance isn't just about avoiding fines. It's about building trust so you can innovate faster. Thanks for watching, and we'll see you next week on the HIPAA Insider.